The hotel and tourism industry are, of course, the backbones to the Caribbean economy. A standard of customer service is what travelers expect when experiencing their hotel stay. Well, the corporate team from Marriott International actually conducted a seminar for their management leaders to remind them of all the details that make a traveler's stay a little more memorable. Our Marisol Rivera brings us this first report.
Tourism is the driving force of the economy of the Caribbean, and Marriott takes guest service seriously by sharpening the skills of its upper management in the Guest Service Satisfaction Summit. Can you tell us about, after the passing of Hurricane Fiona, about the opportunities and the want of the people to travel and the opportunities that your colleagues here have?
Sure. So unfortunately, I will say that we are very accustomed to these storms in the region. It's not funny to mention, but our teams are very well prepared. So we communicate with our guests in advance. We prepare them to be with us if they want to ride the storm or if they want not to cancel. And of course, those are important things that we do always. Our teams are well prepared from a crisis management standpoint, but we have seen that the demand is back extremely fast. Puerto Rico is a very desirable destination. So the consequence of that is right after the storm passed, we start seeing reservations coming back, many that was postponed, refocused, schedule new meetings, and having them back in Puerto Rico.
From San Juan, Puerto Rico, this is Maricel Rivera for One Caribbean News.
All right, thanks so much, Marisol. Meantime, the Bahamas has confirmed its first cholera case in 5 years, but health officials have sought to assure residents there is no need to panic. Health and Wellness Minister Dr. Michael Darville disclosed that the patient is a 52-year-old Bahamian man in New Providence. He said the man did not travel to Haiti, which is in the midst of an outbreak there. The health minister said the country had been on alert since cases emerged in that neighboring island earlier this month. Now it has been confirmed in the Bahamas. Authorities are on high cholera alert and additional protocols have taken effect.
Additional protocols is more closely monitoring our borders, having more healthcare individuals in our surveillance unit, high alert, monitoring our airports, ports of entry, and ships coming in from various different jurisdictions.
Now, Minister Darville said healthcare facilities are equipped to deal with any outbreaks, and Bahamians need to not be alarmed.
In the event that we have cases that supersedes these isolated cases, they're available not only in New Providence but also Grand Bahama, and our team on the Family Islands are also on high alert on how do we isolate the cases. And so these are standard medical protocols that our healthcare providers have the ability to activate in the event that we do have an outbreak.
Now, the health minister has urged residents to take necessary precautions, such as using and drinking safe water and practicing proper hygiene to avoid cholera. Well, illness is contracted by eating food or drinking water contaminated with the bacteria. Well, also in the Bahamas, leaders have announced the steps they're taking to try and ease soaring inflation and the effect it has had on Bahamians. Our One Caribbean News' Deandra Hamilton reports.
In an effort to bring relief to the people of the Bahamas and eliminate the economic burden on families, the government will be adding 38 new items to its price control list. The announcement was made by Prime Minister Philip Davis during a national address to the Bahamian public on Tuesday.
We are limiting the wholesale and retail markup of everyday items like diapers and food like chicken, eggs, bread, bananas, apples, oranges, broccoli, onions, and potatoes. These items are being added for at least a 6-month period, at which point we will review and evaluate the impact on businesses and consumers. We are also reducing the profit margin on price-controlled drugs, providing additional relief to Bahamians.
This move by the PLP administration will limit the effects of inflation on Bahamians for at least the next 6 months, as it now controls the maximum amount of money anyone can pay for these goods. In addition, Davis also announced plans to start the construction of 2 new hospitals in the country.
We will break ground by the end of this year on a new $200 million hospital in Grand Bahama. And tonight, I'm announcing that we have made major progress on securing both the land and resources for a new hospital in New Providence. Our capital has long needed an additional hospital to keep up with expanding healthcare needs.
These two hospitals are major initiatives for the Bahamas, especially for Grand Bahama Island. In 2019, the island's hospital, the Rand Memorial, was severely damaged in Hurricane Dorian. The construction will also be good news for residents and workers who've been calling for a new hospital on that island. DeAndre Hamilton reporting.
All right, thanks so much for that report, DeAndre. Meantime, more air travelers are avoiding checking baggage when they fly. A September survey indicates that 60% of flyers reported some kind of disruption while traveling by air this summer. Of the 1,700 Americans in the trip, its survey, 1 in 6 said their luggage was lost or delayed. Now that tracks with federal statistics that show more than 1.7 million bags were mishandled last year by U.S. air carriers. The survey also shows that 41% of flyers now say they will avoid checking in with a bag in the future. 23% say they will use their own bag tracking technology like an Apple AirTag if they do. Transportation experts agree that staffing shortages at airports combined with high travel demand are the root of the problem.